So PDT is short for photodynamic therapy. That treatment can really help a lot of people where their original therapy just isn't sufficient to treat the disease they have. PDT really is a combination of a fluorescent dye called Visudine, which will inject through the arm of the patient, so a little IV, and it kind of travels from the arm all the way up to your eye vessels. And typically it's used to treat macular degeneration when there's abnormal vasculature. And so it's a combination of this dye that gets photoactivated with laser. Once the dye kind of goes through the patient's body, we wait about 10-15 minutes. And we already had pre-planned and mapped out in the retina like these leaky vessel areas through ICG and fluorescein angiograms, which are two ways that retina specialists use to look at abnormal vessels. So once we kind of figure out the areas we want to target and the dyes through the arm, the patient's kind of sitting up at the slit lamp and the doctor uses the special lens and puts it on the eye, and with this laser beam actually targets those exact vessels, and as he targets it you can see them light up, and it's kind of in a way like photodestruction. So it kind of coagulates those vessels, releases these immunomodulators that help decrease that proliferation. After that, the patient can see, they can drive themselves home, the little IV will be bandaged, and that's it. Drink a lot of water that day of. You'll have a little IV dye, so expect to have a little needle through the arm. That's kind of the worst part of it, to be honest, and the dye will kind of go through. Most patients don't have much reaction, but we do tell you try to avoid the light and sunlight for the next 3 days because it can make your skin a little photosensitive to light. We still use PDT often for CSR, which is resistant to treatment. CSR is a very common disease that you can see in our young population, and there's treatments out there, and some work, some don't, and oftentimes when it's refractory, PDT is still there to help treat. What's interesting is in our practice, Dr. Rosa Kim, one of my colleagues, her lab back at Harvard used to be one of the initial studies for PDT, so it's kind of wonderful to be working with somebody who has all that background.